Hi and welcome to my first vlog on skills and capacities in the weight room. Firstly, it is important to distinguish between a skill and a capacity. A skill issue is related to motor control, and the ability to execute the skill can be determined by how familiar the athlete is with the particular movement set. If the athlete presents with a skill issue, it can quite often be corrected with the appropriate coaching. A capacity issue is related to particular aspects that could prevent the movement from getting better, for example mobility and force production restrictions. Capacity issues cannot be coached, but specific exercises can be given to an athlete to improve the movement. Due to COVID-19 and the gym closures in place, the athletes in this video performed exercises at home with the equipment available to them. When observing the athlete with a skill-based issue, it is clear that he favours the right side throughout the movement. This can be identified from the angle of the bar before descent, but also the position of his pelvis at the bottom of the squat, with clear external rotation of the left hip to compensate for this issue. With the athlete favouring the right side throughout the movement, unnecessary pressure is put through the right hip and right knee. This poor technique could potentially be due to the athlete not feeling comfortable setting the hips back into what is considered a normal position during a squat. It could also be due to a lack of musculature on the left side, which the athlete describes as his non-dominant side. To help the athlete establish what equal gluteal contraction should feel like, I got him to perform a standard glute bridge with the knees bent at 90 degrees, encouraging him to squeeze the glutes at the top of the movement and perform it slowly. I then progressed this exercise to single leg glute bridges, giving him a cue of a plate sat on the hips, so the hips must remain level throughout the movement without any substantial drop on one side. After focusing on the glutes, I got the athlete to perform some squats to a box, giving them a cue of touching their bum on the chair equally on both sides and then to drive up the same as they did in the glute bridge. I felt that it was appropriate for the athlete to do this with no load to begin with and then progress to a back squat to box when competent and comfortable. After exercise progressions were put in place, it was important to reassess the athlete's squat pattern to notice if there was any improvement. As can be seen, the starting position of the bar before descent is still angled toward the right, however less so than previously. Although this squat has less depth, there is significant change in the athlete's external rotation of the left hip, which in turn helps prevent a right side dominance which was seen previously. In summary, motor control issues of the right side dominance were combated by spending a little bit more time on glute control whilst also applying relevant cues to help level out the pelvis at the bottom of the squat, which in turn levelled out the starting position of the barbell. Moving on to the athlete with a capacity-based issue. This athlete demonstrates a satisfactory technical model. There is a break in the hips to initiate the movement, however the depth of the squat is not sufficient, showing an inability for the femur to be in line with the knee and reach parallel. This could be something to do with the athlete's range of movement at the ankle, and this causes slight knee valgus in the transition phase of the squat to be able to produce force. This lack of mobility at the ankle is identified more so from a lateral view. This reduces the stability in the foot, causing the heels to be lifted off the floor to allow for more dorsiflexion. This attempt to create more dorsiflexion allows the knees to pass over the toes. Due to this lack of dorsiflexion, this athlete is unable to sit into their heels effectively throughout the squat. We performed the knee to wall ankle range of movement test with the athlete. This required them to keep the foot on the ground whilst driving the knee forward to touch the wall in front of them. They continued to move the foot further away from the wall until they can no longer keep the heel on the floor. This simulates what should happen to the feet during the squat pattern whilst also identifying if there are any asymmetries with ankle range of movement. Normative data suggests that its scores should be 10 cm plus for each knee to wall test. This athlete tested considerably poor, scoring well under 5 cm on each foot, indicating that there is a capacity issue present. I then got the athlete to perform the active hip flexion test. Due to the joint being under high demand when squatting, it is therefore necessary for it to be mobile. Normative range is suggested to be at 80 to 140 degrees. The athlete again tested poorly with scores at the lower end of normative data at 89 and 83 degrees. After knowing that the athlete had a capacity-based issue with poor mobility at the ankle and hips, the exercise regressions could be put into place to make the athlete move more efficiently throughout the squat. Firstly, addressing the lack of dorsiflexion, I got the athlete to perform some knee drives with a band. Similarly to the knee to wall test, the athlete keeps the foot flat whilst driving the knee over the toes with a small resistance pulling the other way, encouraging dorsiflexion against the resistance. The athlete performed 3 sets of 10 reps on each side. To encourage more depth, I then regressed the back squat exercise to a goblet squat, telling the athlete to go as low as they could, trying to remain a neutral spine throughout. This was then progressed to a back squat with the heels elevated, and this encouraged dorsiflexion whilst also allowing a considerable change in depth of squat, meaning torso angle remained more upright. In summary, the capacity-based issue with this athlete was a poor range of movement at the ankle and a slight lack of range of movement of hip flexion. We improved this by focusing on ankle mobility, in particular dorsiflexion and squat depth, which on a whole improved. The next weight room activity that we look at is a hinge, and more specifically a Romanian deadlift. Although the hips move backwards slightly, it is clear that the athlete presents an inability to disassociate his hips from the spine. The knees remain straight and stiff throughout whilst the bar travels too far down the leg. These moves both contribute to further rounding of the back. This pattern would ineffectively load the vertebra, causing an increased risk of injury to occur. The first of the exercise regressions was the cat-cow exercise. This would help the athlete identify the hip hinge necessary for the RDL pattern. This exercise helped the athlete understand what the hips and spine should feel like during the descent of the RDL. I gave the athlete cues of bringing the belly button down to the floor to achieve the required extended position for an RDL, whilst bringing the belly button up for the opposed flexed spine position. The next exercise was a stick hinge. This provided the athlete with good feedback in regards to alignment of the spine throughout the movement. I gave the athlete cues of looking forward, keeping the knees soft and pushing the bum back, which also allowed for more of a hip hinge to occur. This external feedback of pushing the bum back and keeping a neutral spine was followed with a bum to wall hinge. This is where the arms were folded, and whilst encouraging the athlete again to look forward, keep a soft knee and push the bum back until it touched the wall. This helped increase depth whilst also continuing the hinge pattern and providing the athlete with that external feedback. The RDL was then reassessed in comparison to the first attempt. The knees of the athlete have been softened, which allows the hips to move backwards more readily, creating a more efficient hinge pattern. With cues reminding the athlete to look forwards and roll the bar along the thighs, it allows the hips and spine to work nicely together to reach a more neutral spine position on the descent of the RDL. In summary, this athlete had an inexperience with the hinge pattern, with failure to disassociate the hips from the spine to achieve the desired position. By working on more simple hinge regressions with external feedback for the athlete to understand the movement, this allowed a more competent hinge position. However, this will need to be worked on further to be able to progress to a fully loaded bar. When observing this athlete with the capacity-based issue for the RDL, it is clear that the adequate depth is reached. However, this is achieved by using a double knee bend approach. This technique could be due to a lack of flexibility in the hamstring. This rebend of the knee means there is less stress and stretch on the hamstrings throughout the movement. This knee bend also creates more depth and makes it look as though the athlete can perform the exercise. To confirm whether the athlete was struggling with hamstring flexibility, I got them to perform the straight leg raise. The athlete would lay on their back and lift one leg off the ground to the point where they could no longer go further. This test identified that the athlete's hamstring flexibility was poor. There was a small asymmetry between the two legs too, with the right leg having more range than the left by 6 degrees. This test indicated that by increasing the flexibility and length of this muscle, it should benefit the athlete when performing a hinge. I then implemented some dynamic stretching based exercises for the hamstrings. Firstly, the banded assisted straight leg raise was used. This was then followed closely by hamstring pumps. Ideally, the toes were brought to the athlete's nose throughout both of these exercises, whilst trying to reach as much of a straight leg position as possible until the athlete felt a stretch in the hamstring. The athlete performed these exercises 3 times for 8 reps on each leg. After completing these exercises with the aim to improve hamstring flexibility, the athlete's RDL was then reassessed. Overall depth of the RDL was increased, with no real clear rebend of the knee in the movement. This could be improved further by increasing the amount of time spent on hamstring flexibility exercises pre-RDL and hinge pattern. In summary, this athlete had a capacity-based issue with a lack of flexibility in the hamstrings. Dynamic-based exercises were implemented in the aim to increase hamstring length to avoid a rebend of the knee throughout the RDL. This was achieved, however further coaching and work could be done on improving hamstring flexibility in order to perform a more effective hinge.